This medication is commonly used to treat specific types of cancer, such as multiple myeloma, brain tumor, Hodgkin's disease, and non-Hodgkin's lymphoma. Bicnu Vial contains carmustine, which is classified as an alkylating agent. This drug works by slowing down or halting the growth of cancer cells. The dosage and timing for taking Bicnu Vial may vary based on the specific type of cancer being treated, so it's important to follow your doctor's instructions carefully. This medication is administered by a healthcare professional through a slow injection into a vein. The frequency of the injection is usually every 6 weeks, as prescribed by your doctor. The dosage will depend on your medical condition, body size, and how you respond to the treatment. It's important to follow your doctor's instructions carefully for the best results. Some common side effects of Bicnu Vial include nausea, vomiting, loss of appetite, headache, flushing, eye redness, or pain at the injection site. Your doctor may prescribe medication to prevent or relieve nausea and vomiting. Eating small meals and limiting activity may help lessen these effects. If you experience severe or persistent side effects, contact your doctor. Serious side effects may occur, but the benefit of this medication has been determined to outweigh the risks. Your doctor will monitor you closely to decrease your risk. Contact your doctor immediately if you experience signs of kidney or liver problems, or vision changes. Rarely, people treated with this medication may develop other cancers. Consult your doctor for more details. A serious allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Contact your doctor if you notice any other effects. If you are in the U.S., report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. Bicnu Vial, also known as carmustine, is a medication that may cause serious bleeding and blood problems. This can lead to anemia, lower your body's ability to fight infections, or cause your body to bruise or bleed more easily. Your doctor will monitor you closely during and for at least 6 weeks after treatment to reduce the chance of serious side effects. If you experience symptoms such as easy bruising or bleeding, unusual tiredness, or signs of infection, it is important to tell your doctor right away. In addition, this medication may also cause very serious, possibly fatal lung problems. The risk increases after receiving higher total doses and can occur years after treatment. It is important to tell your doctor right away if you develop symptoms such as a persistent cough, shortness of breath, chest pain, or unusual weakness or tiredness. Always follow your doctor's instructions and discuss any concerns you may have about taking Bicnu Vial. Before starting Bicnu Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you are currently experiencing any other medical conditions. This medication can make you more susceptible to infections, so it's important to avoid contact with anyone who has a contagious illness. It's also important to be cautious with sharp objects and to avoid contact sports to lower the risk of injury. If you are planning to have surgery, make sure to inform your healthcare professional about all the medications you are currently using. If you are pregnant or planning to become pregnant, it's important to discuss reliable forms of birth control with your doctor, as Bicnu Vial may harm an unborn baby. For men using this medication, reliable forms of birth control should also be discussed during and after the treatment. It's also recommended to avoid breastfeeding while using this medication, as it is unclear whether the drug passes into breast milk. Be sure to consult with your doctor before breastfeeding. When taking Bicnu Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's essential to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Bicnu Vial. If someone has taken too much Bicnu Vial and has severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. During your treatment with Bicnu Vial, it's important to have regular lab and medical tests to monitor your blood count, as well as the function of your kidneys, liver, and lungs. Make sure to attend all your scheduled medical and lab appointments to ensure the effectiveness and safety of your treatment. If you miss a dose of Bicnu Vial, it is important to ask your doctor or pharmacist for a new dosing schedule right away. It's important to take this medication as directed to get the full benefits. This medication is administered in a medical facility and is not meant to be stored at home. It is used to treat certain types of cancer, such as Hodgkin's disease, non-Hodgkin's lymphoma, and multiple myeloma. The dosage and frequency of administration will be determined by a healthcare professional based on the individual's specific condition and response to treatment. The optimal timing for taking this medication will also be determined by the healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.